Okay, welcome back to DK Medicines. Today I have come with another topics that is antibiotics. Okay, so watch the video till the end. In this video series, we are going to discuss in detail about the antibiotics. Okay, first of all, the antibiotics are used to treat the bacterial infections. The antibiotics derived from a microorganisms and produced synthetically. Okay, the antibiotics that destroy, inhibits, or limit the growth of the living organisms. Come to the classifications. Okay, here according to the antimicrobial activities, the antibiotics are two types. First one is bactericidals and next one is a bacteriostatic antibiotics. Okay, bactericidal antibiotics, this type of the antibiotics, they are directly kill the pathogens or bacteria. Okay, next one come to the bacteriostatic antibiotics. This type of the antibiotics, they are going to inhibit or halt the growth of the bacteria. Okay, next one is the according to the bacterial spectrum of the activities, here is two types. First one is the narrow spectrum of the antibiotics, another one broad spectrum of the antibiotics. Next one is according to the absorbability of from the site of administration. Here is also two types. First one is a local acting antibiotics, next one is systemic acting antibiotics. Okay, next one come to the according to a mechanism of actions. Okay, here according to mechanism of actions, the antibiotics which is act on the cell walls, that is called the beta lactam antibiotics. Okay, beta lactam antibiotics. Here the antibiotics which is contain the beta lactam rings, that is called penicillins, carbapenems, and cephalosporins. Whereas the antibiotics which is not contain any type of the beta lactam rings, but they are going to inhibit the cell wall formation, that is called the vancomycins and teicoplanin. Next one come to the folic acid synthesis pathway. The antibiotics which is inhibit the folic acid synthesis. Okay, first one is the sulfamethoxazole. They are going to inhibit the formations of the dihydrofolic acid from the paraaminobenzoic acids by the inhibition of the enzymes that is called dihydroterate synthetase enzymes. Next one is the trimethaprimes, that is called that is going to inhibit the formations of the dihydrofolic acids from the dihydrofolic acids by the inhibition of the enzymes that is called the dihydrofolate reductase enzymes. Okay, subsequently they are going to inhibit the formation of the folic acids. Okay, which is responsible for the synthesis of the RNAs, DNAs, or pyrimidines. Okay, next come to the another antibiotics which is going to inhibit the protein synthesis. Here is the antibiotics which is act on the 30s ribosomes. Okay, 30s ribosomes. First one is a tetracyclines antibiotics, next one is a aminoglycosides. Okay, aminoglycosides like gentamicins, okay, kanamycins, amikacins, and tobramycins, and tetracyclines and doxycyclines and minocyclines are there. Okay, next one is the antibiotics which is act on the 50s ribosomes. Here is first one macrolides, next one is a clindamycins. Okay, and another one is a chloramphenicals. Okay, chloramphenicals. Next come to the another ones, the antibiotics which is inhibit the DNA synthesis. First one is the metronidazoles, another one is the fluoroquinolones. Okay, the antibiotics which inhibit the DNA synthesis by the inhibition of the two enzymes that is called topoisomerase second and fourth enzymes. Okay, and also we can say the DNA guidage enzymes. Okay, DNA guidage enzymes. The fluoroquinolone, this type of the antibiotics, they are going to inhibit the DNA synthesis by the inhibition of the the DNA guidage enzymes. Okay, next here we will see the antibiotic resistance and their guidelines. Okay, the bacteria in different population develop the resistance to different antibiotics. For example, Escherichia coli. Here one area of the country might be particularly resistant toward the trimethoprim, whereas the another area of the country They may be resistant to the nitrofurantoins, but still they are sensitive towards the thimethaprimes. Okay, here, so therefore it is necessary to have a local policies or guideline that will decide what type of antibiotics should be used in the area of the country or populations. Okay, here, next one, here we will see the penicillin allergy. Okay, it is very common, and the true penicillins can lead to the anaphylactic reactions or even death. So not be taken lightly. Around 10% of the patients, okay, report the penicillin allergy, and it is often believed that 10% of the patients with penicillin allergy, okay, will have a reactions towards the cephalosporins and carbapenems. In reality, it is closer to only 1%. Okay, closer to only 1%. Next, come here. You have to make sure that, or you have to note that. Okay, this point, while taking the allergy history of the patients, the always asks what type of the reactions the patients have had to become level allergics. Okay, here, if they are reported diarrhea, for examples, the patients are going to report a diarrhea, and this is the one of the side effect rather than allergics. So meaning that they can still receive that are the medications, okay, if necessary, in a life threatening sepsis. Okay, next, here we will see the antibiotic coverage. Okay, antibiotic coverage. Here the amoxicillins, this type of the antibiotics, they are sensitive towards the gram positive bacteria, or they are resistant toward the gram negative anaerobic bacteria and atypical bacteria. Next, coamoxiclav, this type of the antibiotics, they are sensitive towards the gram positive bacteria and gram negative bacteria and anaerobic bacteria, are whereas they are resistant toward the atypical bacteria. Okay, next, come to the clarithromycin, this type of the antibiotics, they are sensitive towards the gram positive bacteria and atypical bacteria, whereas they are resistant toward the gram negative bacteria and anaerobic bacteria. Okay, next, clindamycin, this type of the antibiotics, they are sensitive towards the gram positive bacteria and anaerobic bacteria, whereas they are resistant toward the gram negative bacteria and atypical bacteria. Okay, come to the gentamicins, this type of the antibiotics, they are sensitive towards the negative bacteria and they are resistant toward the gram positive bacteria and anaerobic bacteria and atypical bacteria. Okay, come to the ciprofloxacin, this type of the antibiotics, they are sensitive towards the only gram negative bacteria and atypical bacteria, rest of their resistance. Okay, next, come to the another antibiotics, that is metronidazole, this type of the antibiotics sensitive only towards the anaerobic bacteria, the rest of their resistance. Okay, come to the doxycycline, this type of the bacteria, this type of the antibiotics is the broad spectrum antibiotics, they are sensitive towards the almost all type of the bacteria. Okay, and next, come to the vancomycin, this type of the antibiotics is mostly sensitive towards the gram positive bacteria or Yamanashi bacteria. Okay, Yamanashi methicillin resistance bacteria. Okay, or resistance to rest of the bacteria. Okay, next, here you have to make sure that this table is not accurate and should not be used for treating the patients, but it is helpful to gain an understanding of the general pattern of the antibiotic coverage. Okay, next, here we will see the stepwise process of the escalating antibiotic treatment in the hospital to remember what type of the antibiotics cover what type of the bacteria. Okay, here first of all we will see the amoxicillins is going to cover the streptococcus infections and listeria infections and enterococcus infections. Okay, next one is the coamoxiclav, this type of the antibiotics, they are going to cover the staphylococcus aureus infections and hemophilus influenza infections and Escherichia coli infections. Okay, next one is the tazocins, nothing but piperacillin with tazobactams, they are going to cover the pseudomonas aeruginosa infections. And another one is another antibiotic that is called septaginims, which is comes under the cephalosporins third generations, they are also going to cover the pseudomonas aeruginosa infections. Okay, next one is the meropenem, this type of the antibiotics, they are going to cover the ESBL type of the bacteria and that spectrum of the beta lactamase producing enzymes, that is called Escherichia coli and Klebsiella bacteria. Okay, these two type of the bacteria is going to produce the tended spectrum of the beta lactamase enzymes. Okay, here the teicoplanin and vancomycins, this type of the antibiotics is going to cover the MRSA. Okay, and come to the clarithromycins and doxycycline, this type of the antibiotics, they are going to cover the atypical bacteria. Okay, next one you have to remember that the metronidazole, this type of the antibiotic is going to cover the anaerobic bacteria. Okay, so thank you for watching my video. If you like my videos, share and subscribe. Thank you.